The visual skills are very important to a person's ability to learn.
Anything in the visual process that isn't working effectively is going to interfere with the process of learning.
It is an essential part of being able to read, process information about what you read, and function in the classroom activities.
Vision is a learned process. We're all born, most of us, with the hardware, the equipment to see well, but when you first open your eyes, your brain has no sense of what your eyes are looking at.
The way the visual system develops in a normal way is providing a child an opportunity to engage in the real three-dimensional world.
The biggest myth is that most people think that 20/20 is perfect vision, when that can be farthest from the truth.
If you don't have proper eye movements, and if the eyes aren't working together as a team, and if the eyes aren't focusing properly, then it's going to be tougher for that person to learn.
But the kid can read the big chart in the nurse's office. Why is he having trouble? What's wrong with his eyes?
Vision is not only the ability to see clearly, but the ability to understand what you see. And in order to be an efficient learner and an efficient person in life, you have to be able to do it quickly, comfortably, accurately, and for extended periods of time.
Well, my daughter Reese is very energetic. She is a ball of activity. She doesn't stop moving. You know, we read every night, or we have her reading. It was always a battle. She didn't always want to do it. And she was struggling with words, like I said, very simple words that she'd see them over and over and over again on the same page, and it was as if she had never seen it before. And so just something just didn't seem quite right. And she was doing letter reversals and some other things, and that's what kind of pushed us to at least get her tested. So we took her to an ophthalmologist, and he checked her vision, and it was 20/20, and she could track, and so we just assumed that vision wasn't an issue. And so when we had talked to another specialist, he asked us who we had our eyes checked by, and we just told her it was just a regular ophthalmologist. He says, well, you really should see an optometrist with a vision development background.
There's a distinction in the medical community over structure versus function. There's a lot of ophthalmologists and primary care ODs who look at the intervention of eye disease and on eyesight.
We're looking at how the person functions, not just their eyesight.
And we certainly had no idea. We had our eyes checked, everything seemed to be fine, but it turns out that actually from a development standpoint, she wasn't quite where she needed to be in terms of having her eyes work automatically, something we take for granted as adults, the ability to track things and do multiple tasks while doing something visually. Kids have to learn that, and she wasn't quite where she needed to be.
As a first grade teacher, the thing that you need to be able to do is to teach kids to read. And I believe that you don't actually teach kids to read. You figure out how to allow that to occur, because they'll do it unless there's something in their way.
With reading, our eyes track across the page. And if the eyes aren't aligned well or have trouble tracking, you can read and misread and jump around instead of tracking smoothly.
When it came to her eyes tracking objects, for instance, reading words on a page, once you start adding additional elements that the brain has to do, such as decoding the words, sounding them out, understanding what they are, that form of cognitive loading, her ability to track starts to suffer, and therefore reading became more challenging for her.
When a child has a problem with their visual abilities, that means that they're lacking in some of the fundamental learning and reading readiness functions of vision. Now, when that occurs, that dysfunction or delay in development means that that child doesn't have the visual tools in their toolbox to apply themselves effectively. They go into that classroom setting or to the reading task with a disadvantage.
Like I said, the fact that she couldn't remember words on a page that she had seen, the fact that she really wasn't liking to read, that she was really almost avoiding it. I mean, she would get people to do it for her any time she could. If she saw a sign, she'd make no attempt to read it. She'd ask us to, she'd say, well, what's that say? And we'd say, well, read it. She says, well, never mind, I don't really care.
The smarter they are, the greater the frustration, because they look around the room and say, why can they do it and I can't?
When something is difficult and takes a very long time, you don't like it. So one of the biggest problems with visual skills as they relate to reading and learning is that if the child doesn't like what they're doing, they don't feel proficient, it takes
so much effort and time, they're not going to do it a lot. If you don't do it a lot, you're not going to learn.
Read only when they have to. They skip words. They lose their place. They might use their finger to keep their place. The words jump around, they move around, and it makes it very hard to be able to remember what they're reading. So they might get to the bottom of the page and just wonder what they read.
Many of these children who have these visual problems oftentimes look like they have ADD. And as a result, they can be labeled with that condition and misdiagnosed when really their visual problem is creating the symptoms and behaviors that masquerade as ADD.
Most of the patients that we work with come in with some sort of visual dysfunction that once they learn an easier way to do something, we always adopt the path of least resistance and do what's easiest.
Vision therapy is an effective treatment modality to help children and adults who have problems in vision development. Through a process that involves them working one-on-one with the doctor and vision therapists in activities that are designed to create a visual challenge.
Most people develop these visual skills and abilities, but we're seeing at least 1 out of 5 children and adults will never develop efficient eye movement control, focusing, binocular fusion skills, essential visual skills involved in reading, unless they are taught. And that's what vision therapy does. It's a program where the doctor is the coach and helps to teach the patient how to do things that for many people just come automatically.
Some people think that vision therapy is physical therapy for the eyes, and that's part of it. But it's more how your brain tells your eyes where they need to look, how they need to look, and directing your vision system.
With any new learning experience, it takes a lot of practice and a lot of habit and repetition before it becomes kind of unconscious, natural behavior.
If we can, over time, and neuroscientists have confirmed this clearly over the last 10 years, repetitive engagement in novel situations with conscious awareness of that activity ultimately results in the ability to transfer this new acquired skill into automatic areas of a wide variety of human activities.
Let's say, for example, with a Brock string, typically you would have one rope, one string, but as far as the brain is concerned, there are 2 different views of that. So you have 2 different angles out in space, and where I aim my eyes, where the brain aims the eyes, is where the axes of the 2 strings are supposed to meet or intersect.
You know, the muscles that are inside our eyes and outside of our eyes that control the focusing and movement of our eyes, they're under our voluntary control, and they are striated muscle, just like the muscles in our fingers and our arms. They can fatigue, and if you're not using them in a skillful way, they can fatigue very quickly.
If somebody's having difficulty using both eyes together, the symptoms that will go along with that are related to headaches, instability of print, difficulty concentrating, fatigue, and difficulty with comprehension.
Often kids that have underlying vision problems, they start to feel like they can't do things. They feel stupid. They're embarrassed that they can't read out loud and read as fast as the other kids. So it starts to affect them in every aspect of their life.
Imagine that a child is at school and everything is harder for them. Their eyes are tired, they have headaches, they see double, they have difficulty with their focusing. Now that's hard enough, but then at the end of the day, they're being asked to do homework, sometimes a lot of homework. The homework takes them longer. They don't want to do it, so they're acting out.
When someone has gone through a vision therapy program, not only does their self-esteem improve, but they're engaged, they're happy in the classroom again, they start to enjoy reading again.
She's great. Like I said, she's reading now, and she enjoys reading, which was something that was not the case before. She has the ability to retain things on the page better. She recognizes words now and sees them. When she sees them again on the page, she knows what they are instead of having to kind of sound them out all over again. When she was tested, initially she was below her age in almost every category. Now she's at or above her age in most of the categories that Dr. Fortenbacher checked her on. So her hand-eye coordination has gotten better, and yeah, I think we're very happy with how things have gone and how it's turned out.